Right now I have with me representatives from the SGU Health Fair. Yes?
Correct.
Good morning. And welcome to Daybreak Grenada.
Thanks for having us.
All right, so introduce yourself, so the folks who you are.
My name is Robin. I'm a second-term student at SGU, and I'm the president of the SGU chapter of AMSA.
And I'm Michael. I'm the Health Fair coordinator for this term. Basically, a term is basically 4 to 5 months for the students per year. So.
Okay. AMSA. What is that?
That's the American Medical Student Association.
Oh, okay. So you're both medical students, right?
Both medical students.
Okay, good. Now tell us what's happening at this health fair. When is it?
It's this Saturday.
This Saturday
and
as well.
We should be starting around 10, is that correct?
We should be starting around 10. It's at the Constantine Methodist School. It's close to Annandale Falls, I'm told.
I think it's in New Hampshire. Is the address not so?
They told me it's in St. George.
I don't know.
So,
I can't. Okay,
yeah.
It's in St. George's.
Correct.
Right.
Yeah.
Constantine Methodist
School.
Right. And what's going to be happening at the fair?
We have a lot of things going on at this fair. It's not just AMSA showing up, it's actually AMSA, Women in Medicine, Pediatrics, and Family Medicine. And basically we all come together to serve the community, try to provide things that normally maybe the community doesn't get a chance to get.
Oh, so it's for the community.
Absolutely.
Okay.
Yeah.
All right. Good. All right. What do you two do specifically there?
At the health fair? Well, we have a variety of stations, different basic skills that the students can perform to provide this health check for the community. And some of them include vitals, blood pressure, heart rate, respirations, hearing and eyesight tests, glucose monitoring, and I think now we're doing the sickle cell anemia trait testing.
We don't have sickle cell yet, but it's in planning.
Right. Okay.
Hopefully, and we're hoping to have cholesterol testing as well.
Cholesterol testing.
But that's in the future. But we hopefully can get that in.
Okay, get that into this weekend's event.
Not this weekend, but hopefully our next one.
Oh, you plan to have a few of them?
Oh yeah.
Yeah. Well, during the year we have about 5 to 6 health fairs, and from now until April we have this one coming up and the one in April. So 2 for the first half of the year.
Okay. Tell me about past health fairs and how they turned out, if you can, of course.
The past health fairs have been pretty big success. We usually have about 100 to 200 patients come through. And the students, of course, love it because it's hands-on experience. Yeah, they've been great.
Okay, so it's the students that actually do all of the testing and everything?
Yes, the students do the basic preliminary testing, and then, of course, we have real physicians there, or finally graduated physicians, and they will be, completing the physical examination at the end.
Okay, good. And you say about 100 or so people show up?
Yeah, sometimes more.
Yeah. I notice you call them patients, so everyone that shows up is a patient.
Everybody
instantly.
shows up as a patient.
Yeah.
Yes.
All right, okay. I noticed that you have some instruments here.
Yes.
You plan to start the health fair now.
Yeah, we're going to start with you. You're going to be patient
really?
number 1.
Okay.
Patient number 1.
Nothing that involves any needles or anything. Huh? I don't want to be bleeding all
No,
over.
just a needle about this big, that's all.
You know what, I can take it. Let's go.
What we have here is the blood pressure cuff, so
Okay, gonna check my blood pressure right now.
I hope you stay in shape.
I hope so too.
Your viewers are about to know if you do. You can just rest your arm on the table.
All right, okay. So this is just a demo of some of the things that can happen at the health fair. Some of the things you can get checked, right? If it's bad, don't say it out loud, okay?
We'll lie.
All right.
It was good. 124 over 78.
All right. I don't know what good is, but you say it's good.
Well, that's good.
Normal ranges for a healthy individual is 120 over 80. So you're pretty much in that range. So
Okay.
you're fine.
Okay, good. That's good to hear.
Healthy.
So I don't need to come to the fair anymore.
Well,
We have other testing that has to be done. And you have to see a real doctor.
Okay. all
Well,
right.
another really popular test we do at the health fair is glucose testing. So we actually prick your finger for blood, and we test it, and we give you your sugar levels in your blood.
Right.
And that's a really popular thing that I've found that Grenadians really want to know, is finding their blood glucose.
Why do you think that is?
I think it's because
There's probably a prevalence of diabetes in Grenada, as well as what's called metabolic syndrome. So all of these things, we put them together for the doctors to view at the end, and they can put together a complete picture of the patient's health as they
Okay.
come through.
All right, cool. So, okay, I just got part of it done. I have to come still to get everything else tested,
Right.
you know, my glucose testing and everything.
Exactly.
Glucose, hearing, vision, and these are all pretty much preparations for you so that the doctor, when you do see the doctor at the health fair, he can make a good assessment of your health, and he can tell you what you need, or he can refer you to another doctor, and that's a really important thing, is so the doctor knows everything that's going on with you.
Okay, so if you can just tell me all of the tests right now, just in case someone's at home and they're interested in testing something specific, just run through all of your tests and all the checks that you would be doing at the fair.
Starts with vitals, so we'll do heart rate, respirations, blood pressure. Then you will move on to eyesight, hearing testing, glucose monitoring, and then a physical examination with one of the physicians.
Okay. Now, let's say I come to the health fair, and in my case here, let's say I tested my blood pressure and it ended up way over what it's supposed to be. Do you recommend me to a doctor right there? What do you
Right, so you'll immediately go to see one of the physicians that's at the health fair,
Right.
and then they will recommend for you to
Okay.
go to another doctor.
Okay, good.
You're probably whichever doctor you've been seeing.
You might even get a prescription. Some of the doctors there are allowed to give prescriptions, so it really depends on the individual and what the doctor wants to do.
So it's like a kind of full package thing you have going on there at
Yeah.
the fair, right? You come there and one-stop
The whole
medical
deal.
shop.
Yeah.
Right.
I mean, we don't want to take away from the hospital or a real doctor. This is just kind of a basic checkup.
Right. And of what cost is this to the patients?
Absolutely free.
It's
Absolutely free.
Our main purpose is to serve communities that might not normally have the chance to do it, so like underserved communities. And basically, it's the Grenadian Health Ministry and the SGU Health Clinic figuring out areas that have need for this kind of health fair. So.
All right. That's it. What areas have you been to before?
We've been all around.
All
St. George's
around.
a couple times at different locations. St. Patrick's, I believe. I think they kind of just try to put it at a different place every time,
Right.
a different parish.
So do you know where you're going to after this one?
That hasn't been decided yet.
Okay.
But
Okay.
yeah, they're still planning it out.
All right. So anyone in and around that community can come to the health fair at Saturday from about 10, you said, yeah?
Correct.
All right. 10 till when?
10
2:30, 10 to
2 p.m.
2:30.
Yeah.
Usually we just kind of wait until the patients stop coming.
All right, okay. Well, that's a good stretch, 4 hours or
Yeah.
more or less, right? Okay, good. Did I miss anything?
No.
That's it.
No.
Yeah.
No.
Any
I mean,
other
that's what
tests?
we do. There are other clubs going. So if the women in medicine, a really important exam they do is breast exams to
okay.
check for cancer or anything or
All right.
tumors. Peds if you want your children to get checked up. And also in April 21st, our other health fair, the vet school is joining us. So you can check your dogs, your cats, that kind of stuff.
Oh, nice.
Yeah.
That I haven't heard before, like bringing animals to the health
So
fair.
it's a new concept called One World, One Medicine, or One Health, One Medicine.
Yeah.
Something like that. It's an idea that kind of get everything checked out.
Oh, nice.
Your dogs and your pets can affect your health as well.
Is this limited to domestic animals, or you can bring your cow and your goat and...
I'm sure the vet students would
Yeah.
relish the opportunity to check out a
Right.
cow or a goat, but
Right.
yeah, I think it's usually just the domestic animals.
Okay, all right, okay. All right, cool. Well, thank you very much for coming
Thanks
in
for
and
having
sharing.
us.
Yeah.
All right.
Thanks.
So, health fair this Saturday from about 10 till 2
p.m.
2:30.
Yeah, let's say 2:30.
Constantine Methodist School.
Constantine Methodist School. All right, the SGU Health Fair. All right, thank you guys for coming on.